Hey there, everybody. Welcome to the Jibs podcast. We have a really exciting episode today. I have Paul Thomas here with me, who runs Plum Health. And Plum Health is fascinating because the mission is providing affordable healthcare to the people of Detroit, which is very needed and which is what we're going to cover today.
Yeah.
And Paul, if you just kind of want to tell us about who you are, how you got started in medicine, and what Plum Health is all about.
Yeah, so my name is Paul Thomas. I'm a family medicine doctor. I did my training at Wayne State University School of Medicine here in Detroit. Mm-hmm. And when I was 17, I started volunteering at a free clinic on Cass Avenue and working shoulder to shoulder with Wayne State med students. And I was so impressed with the students that they were able to take care of homeless, uninsured, elderly folks who were vulnerable in the community. And then I met the doctor who was overseeing everything, and at that point I knew that family medicine was the type of service that I wanted to provide to the world. Mm-hmm. And so I really set my sight on going to Wayne State and being one of those students who ran that clinic in the future, and also giving back in that really tangible way.
Yeah.
And my business, Plum Health, kind of embodies those ideals of providing affordable, accessible healthcare for everyone, regardless of your income level. What I say is, like, if you have an income, you can afford our service. It's about $10 a month for kids, and it's about the cost of a cell phone bill for adults. Mm-hmm. And so that's what I do. It's a membership model. People can come and see me whenever they need me. They also have my cell number, so they can call or text me whenever they might need me as well.
Yeah. So, obviously, there's a lot of healthcare concerns in the city, whether it's like access to healthy nutritional foods or just local clinics that people can go to. So really starting Plum Health, where did you start in the city, and how did you start getting people to really buy into what you were doing?
Yeah, I think any business starts with the relationships. Yeah. And for me, part of those relationships were formed by taking classes at like Build Institute or Tech Town here in Detroit, and having a cohort of people who heard your story and understood what you believed. And those people became my first champions, my first customers, the people who vouched for me in the community. And I wanted to create like a neighborhood-based business, but I didn't know where to begin. So I started by making house calls. My first 2 months in operation, started making house calls. I had about 10 people sign up, and then something kind of fell into my lap where I was able to sublease a one-room office. It's about 200 square feet, 184 square feet, and that's where I service people at this time. And now we have 250 members. Wow. So it's grown that amount in about 15 months.
Mm-hmm. That's incredible. So is it just you running the business right now?
Yep. Yeah, I'm the doctor. I do the billing. I make the phone calls and pay the rent and all that kind of stuff. I do have students who rotate through, like PA students from Wayne State, medical students from Wayne State, residents. I have a nurse practitioner who comes and hangs out with me on Wednesdays at this time. So, I try to give back to students as well, try to teach them what I know about family medicine.
Okay. So can you explain kind of the difference between direct primary care and any like traditional settings? Yeah, in traditional, I think we've all been there. Yeah. You go to the doctor, you wait an hour, you get seen for 10 minutes. You can only ask one or two questions because they're in a rush. They're like checking their watch, trying to get out of there. And then they write you a script. You go to the pharmacy, you might wait another 30 minutes or an hour to pick up that medication. And you kind of have to take a whole half day away from work, or maybe the entire day, just to get something relatively simple taken care of. Mm-hmm. So my model, it's less transactional and more relationship based on a long term. So people pay the membership. I guarantee on-time appointments. They come in. They might need 15 minutes. They might need an hour. Mm-hmm. It's really up to you how much time you need. That's how much time I'll set aside to take care of whatever it might be. Right.
And then as an added perk, I have medications in the office. I do wholesale meds. So if you need something, 9 times out of 10, I'll have it right on the shelf and you'll walk out of it, so you don't have to make that second trip.
Oh, I see.
And, usually traditional model is more expensive and the prices aren't as transparent. In my model, the price is right there and the medication costs are printed on our website as well. So, from kind of like from soup to nuts, what you're getting.
Yeah. So it really seems like such a obvious thing for people to do, right?
Yeah.
So, you're getting a really personal relationship with your doctor, with your physician.
Yeah.
You get a lot lower of a cost.
Sure.
So why isn't it more popular?
I think two things. I think on the consumer side or on the customer or patient side, it's an unfamiliar territory.
Yeah.
And it's not health insurance, right? That's the catch.
Right.
The $50 covers the health care portion of it, and not health insurance. You still have to carry a health insurance policy. So for people that's like, you mean I have to pay for health insurance and then health care? I don't know, man. My argument is like, once you get comfortable with the service, you can kind of back down on your health insurance coverage because I can take care of the majority of what you might need in a year. So you might be able to save money in the long term. And then the other part of it is from the physician, like supply and demand. The physician supply is low because as for a doctor, you have to take a risk. You have to forego the guaranteed salary that you might get through a larger health insurance-based practice.
Right.
And you have risk in starting a business and learning all the ins and outs of a business in addition to medical knowledge. A lot of doctors they ain't willing to do that. They're not willing to do that. So it's a two-sided issue.
That totally makes sense. And since you're gaining traction really fast and a lot of momentum, do you find it hard to be able to care for so many patients?
Yeah, so I think one thing is that I've added on average like 21 new people a month.
Yeah.
So that's like one new person every workday.
Right.
And so that allows me to spend typically an hour to an hour and a half with people on their first appointment, depending on how much they have going on. One initial appointment was 2 hours. This guy had so many questions, but that's fine.
Yeah.
And it's the front end workload is pretty high in terms of getting records releases and doing all that. But then as they're comfortable with the service, their needs kind of taper off as we get things under control and all their questions answered and everything like that. So I think as I've ramped up, some of my busiest months have been kind of overwhelming, but they've kind of been tempered with some slower months. Like December was a little bit slower because people are like, Christmas is here and they're not really thinking about their health care.
Right.
But then January 1st came and people were like, hey, I have this new health insurance plan and I want to pair it with your service. Or my insurance coverage changed, or I changed jobs. And I've had a lot of people coming through this month. So long answer to your question, I know, but I think it's been so steady over time that the growth has been so steady that I've been able to manage it pretty well so far.
That's legitimate. And is out of all these people that you're servicing, is there anybody that I feel like you've probably come across some crazy stories or like some characters. I feel like maybe sometimes, have you ever come across somebody that has a problem that is very heavy and they start telling you their life story and maybe you end up becoming like a psychologist at some point?
Yeah, I think in terms of like family medicine, our scope is really broad. So like today I had an appointment with a 12-week-old baby. And that was like a well child visit. And that really makes my day because babies are super cute. And then my oldest patient is 91.
Wow.
And I made a house call for them because she was having an issue that needed kind of some urgent surgical management. She had a hernia.
Wow.
And so I was able to text the surgeon that day, get her in for an appointment that day. And then she had surgery the next morning. So like those are the kind of stories where this is really impactful. In terms of people like telling me their life story, and that's fine because I have enough time,
right?
To spend that hour and listen to that life story. I might cut you off at the hour mark and be like, maybe we can pick up this conversation next month. But in terms of like the scope of practice, I take care of diabetes and high blood pressure, but also depression and anxiety.
Yes.
And listening to people's story is part of that understanding and part of that healing process. I believe that if I really know your story well enough to understand where you're coming from, the things that haven't worked in the past, the things that have worked in the past, I can be more robust in our treatments going forward and more understanding to come up with the best plan.
I see what you're saying. And I feel like that helps you grow as a caregiver.
Right, yeah. If somebody has X, Y, and Z issue and A, B, and C treatments didn't work, then I can start to think outside the box and try some other things, maybe some complementary alternative things, or maybe a medication that they haven't had.
Yeah.
And the time to understand what worked and what didn't can kind of accelerate my growth as a physician because I start to understand the full story.
Absolutely. So another thing with this podcast is that when I have people come on, I do want to talk about how they went through their entrepreneurial journey, kind of the roadblocks maybe they've encountered. So before you started Plum Health, were you a practicing physician?
Yeah, so I graduated from residency in 2016. About June 30th was my graduation date, last day at work.
Mm-hmm.
Woohoo! And then I started Plum Health November 1st, so it was about 4 or 5 months in between those two dates. And in that time, I took 2 business courses, and I read as many, and I still read. I probably read about 2 books every month, 2 to 4 books every month. I try to do 1 book every week, but sometimes it's tough.
Right.
And I think those business classes paired with reading other entrepreneur stories kind of helped me accelerate my growth as an entrepreneur myself.
Yeah. Are there any books that you're reading that you recommend?
Oh, yes, for sure. Heck yes. I love Gary Vee.
Gary Vee. Yeah, man.
Just get in front of the camera, tell them exactly what to do. My name is Dr. Paul Thomas. I'm delivering that's like the Gary Vee. That works to an extent.
Yeah.
But also like Sheryl Sandberg's Lean In. One of the biggest takeaways I took from that was I think it's on their face, on the wall of their business, they have done is better than perfect. Done is better than perfect.
Right.
And that for a physician, they don't tell you to do that in medical school, right? A lot of doctors have analysis paralysis where you overanalyze every aspect of a treatment decision. But in business, it's completely different. When you're 75% sure, 80% sure, you make a decision and you move forward.
Yeah.
And Stanford has an entrepreneurial podcast saying one of their business leaders said, it's not the decisions, it's the decisiveness.
Oh yeah, that's
right?
a big one.
And then right now I'm reading Shoe Dog by Phil Knight. Okay. And one of the things that he's talking about is fail fast, fail often. Make those decisions, make the mistakes, learn from them, and grow as quickly as you can.
Mm-hmm. Yeah, I definitely feel like a lot of people are very hesitant to even begin because they want everything perfect.
Yeah.
And that in reality, that'll never happen.
Yeah, it's never the perfect time. It's never the perfect time to start a business. It just isn't.
Never.
And you're never ready to start a business. You just either do it or you don't.
Yeah, man. Another thing is that, in Detroit is growing in the startup scene. There's a lot of businesses interested in coming to Detroit. But there's also a lot of people here that want to start their own businesses, whether it's in the medical field or in tech or whatever, right?
Right.
And there's 2 viewpoints that I've come across. One is that, there's not a lot of resources or not a lot of people here willing to connect with you and provide those resources for you. But then there's another group of people that are like, there's so many people here that are willing to help you out.
Yeah.
You just got to find them and connect with them because the space here is very open and collaborative. What have you found to be true?
I'm definitely in the second camp.
Yeah.
There are so many people here who are willing to help. And there are so many opportunities. I'm talking to you. Get out there. So Build Institute is a great resource. They do a sliding scale on tuition fees, but it's between $0 and I think $499. If I'm misquoting them, sorry. But it's 8-week course. You learn kind of like soup to nuts how to run your business, from branding, marketing, to accounting and legal, to how you lay out your business, how it should look in the physical space. Right. So I love that class. Tech Town was like the next thing, the retail boot camp. I took that class, and that's a phenomenal resource as well. Bamboo has a great ecosystem. Amanda Luan and her team at Bamboo kind of cultivate the scene of entrepreneurship where they bring in guest speakers and lecturers, and you can get a hot desk. And then there's places like WeWork, which is like more corporate version of like co-working, but they also put on events and pitch competitions. There's like a WeWork Creator Awards in Detroit, and they gave out a ton of money. And then like Motor City Match, you know, there's that whole channel.
You're a testament of that, right?
Yeah, I'm a Motor City Match winner. You can be too. You know, it's just all you have to do is write a business plan and pitch your idea, and then get to know the Motor City Match people and help them to understand your vision and why it's important for Detroit and what you can do for the residents here. I mean, I could go on and on. I'm going to keep going. I just pitched at Kaiba Accelerator last night. Oh, yeah. And that was in front of investors and lawyers and accountants and people who are really geeked about the entrepreneurial scene. So that's out there as well if you want to attend one of those. And the scene is welcoming. And I think 15 people came up to me after the pitch and handed me their business card, and they were like, if there's anything I can do, let me know. And they varied from investors to accountants to just people in the community who wanted to see me succeed. So I think to answer your question, there's just so many resources in Detroit right now. Detroit's hot for entrepreneurship.
It's so hot.
Yeah.
Which is a huge reason why I wanted to start this thing and just let people know that, you know, there are a ton of people doing a ton of different things, and, you know, anybody else can. Hey guys, so at this point the video actually stopped syncing with the audio, and the camera stopped recording audio for some reason, and I think it's because my SD cards just don't write fast enough. So like I said in my introduction video, I'm learning, and unfortunately the rest of the video is like, it's gone. There's a lot of good information on there, but I do encourage you to go check out Paul's website, plumhealthdpc.com, and check out what he's doing. It's really amazing. But thanks again for listening. Thanks for putting up with me. It won't happen again. Sorry, Paul. All right. Take it easy.